We always talk about the unseen population, but I always say our migrant farm workers, unfortunately, the unseen of the unseen.
Blue Ridge Health has been around for 60 years, and it started off as a migrant farm worker clinic. And so we have been doing migrant farm worker outreach for 60 years, which is incredible. The food on our tables, the food in the grocery store, everything we consume is attributed to migrant farm workers. We would not have food on the table without them.
If they don't ask for help or sometimes, they don't feel comfortable, to find doctors unless somebody give them the correct help or the answer to get some help or where to go. I never went to the doctor and I never looked for one because I didn't know where to go,
The biggest help that Blue Ridge offers our migrant farm workers is the outreach department. We are out there locating them and bringing them into our facilities.
Compassion is absolutely the biggest part of outreach. Being able to go to them speaking their own language and give them the healthcare services they need that inspire hope. It is just beautiful.
Doctor appointment, transportation, vaccination, it makes me happy, to know, there is all this kind of help.
Blue Ridge Health started in 1963 to provide primary care for migrants and others. It was started by a nurse who had the great foresight to take care of vulnerable populations, folks that didn't necessarily have access to health care like others. From those humble beginnings, we began to then move into the community health center world in the late to mid-'80s.
We opened our doors to anyone and everyone who needed our services. And we've continued to expand from there. We want to make sure we're there for everyone and for all of their needs throughout their life.
Blue Ridge started just in one small town in one county in western North Carolina, and now we cover 10 counties with primary care, behavioral health, dentistry, pharmacies, school-based health centers. In addition to that, we have a number of innovative programs, such as we work with the Teaching Health Center to train other family docs to get jobs and be part of Western North Carolina. Healthcare at its foundation is really about compassion and respect and meeting people where they are. And that compassion is really the essence of what Blue Ridge does.
I've been driving the dental bus for over 16 years. Over the years, I've seen the need for dental care in Western North Carolina. It's sad because if you don't have a healthy mouth, then your body is going to feel the effects of that also. It's all connected. The most fulfilling part of my job is just seeing the patients get the dental services that they're in need of. People can't afford dental care. When Blue Ridge is able to provide that service for them, that takes a burden off of the parents, the adult patients too.
What I have found over my 14 years working at Blue Ridge Health is that the mission is what draws people in. People have servant leadership. They want to serve their communities. They want to help others. And that piece of the mission really is what ties us all together in the work we do every day.
It's really touched my heart, and there have been times that I have cried. For Blue Ridge Health to provide that service is just a great thing.
We're constantly assessing the services that we're already providing. What can we do differently? What additional services can we add on? What is going to be most beneficial to our patients? So in 2008, we had one school-based health center, and today, in 2023, we have over 30 sites. And really that's due to the needs of kids in schools. We also have a prescription assistance program where we will help people get their medications for free. So we work very hard to make sure that our patients have access to their medications, including delivery to their homes.
There are a number of needs that patients have that are important for their health. And if we can provide, if you will, preventative services, get people some behavioral health, teach them about how to create resiliency within themselves and their lives, we're going to have a better opportunity to serve those people and create a better environment for our future.
Through the years, we have certainly noticed an increase in mental health concerns and substance use disorder conditions. The support that we have from the community has allowed us to grow and expand over the last few years to where our behavioral health department has really quadrupled. Anyone that needs to access care can walk into any of our sites, and we're going to do everything that we can to serve them same day and or get them linked to the resources that they need to support their healing journey. We have several offices throughout Western North Carolina providing a variety of behavioral health services. If someone comes in and they don't have basic needs met like food, clothing, shelter, we have resources to jump in and support and meet those basic needs so they can then access all of our other services to support their healing and well-being. The mind really controls the body and vice versa, so we've been able to respond and meet that need through support in the community by increasing our workforce, increasing training, and offering additional sites and services throughout Western North Carolina.
Just by the definition of a community health center, it's about communities. Each place that we are, we try and create an environment that allows us to be a collaborator, to be a participant, to be a leader.
People are connected to their communities, but then they become connected to a bigger community with Blue Ridge Health.
I grew up in Franklin, North Carolina. I had a love for connecting with people and science, but my real passion is in changing how we provide medicine. I think everyone should have access to affordable and compassionate health care, and that's really what brings me to work and what excites me. Providers and staff.
They can walk in and not have a dime in their pockets, and we are there for them. Anything you walk in here and you need help with insurance, we got you. We got your back, and that's what I love about Blue Ridge. Everything is there for patients.
We're always asking, what is going to make the patient's experience most comfortable, most timely? This is a place that they are known, and it's a place where they can find community. So one example of that is the vegetable garden and the flower garden that we have out front. If you grew up in a rural area or a small town, then you tend to garden, and that's a really unique and therapeutic way for us to connect. And it's something I love connecting with patients about.
One doesn't have to go far in order to be inspired by the incredible people that work for Blue Ridge Health. I know that translates because I've heard it from patients, how grateful they have been to have a place like Blue Ridge Health to get their care.
Everyone has their part to play. Whether you're a provider seeing the patient or a front desk person who's checking that person in, one of our outreach workers who's out in the field, and there's no one piece of that that's more important than the other. It all has to work together to make sure patients get what they need.
Based on the fact that we've had a 60-year history of great, compassionate people working to improve the lives of our neighbors and families and friends, I'm excited for the next 60 years to see what Blue Ridge Health will bring to the people of Western North Carolina.